This is our episode 3 for Neurology Road to Residency podcast. And I am Sayeeda Taiba, President and founder of a student interest group in neurology at Dow Medical College chapter. And today we have our very special guest with us, Dr. Schuyler. And I would hand this over to Dr. Schuyler to introduce herself. Hello, Dr. Erica Schuyler. Can you please introduce yourself for our audience?
Sure. It's great to be here. My name is Erica Schuyler. I am the residency program director at Hartford Healthcare and University of Connecticut neurology program. I've been the program director there for a very long time, a little bit over 16 years now. And I'm very involved in outreach for applicants in neurology. And I'm looking forward to sharing some advice today.
All right. Thank you so much. And we will begin with the podcast here. So yes, Dr. Schuyler, we will be starting with one of the most demanding questions from our audience and students at Dow Medical College, which is that when you are reviewing the CV and when you are seeing all of the thousands of applications, what is the most important thing that you see in CV or in personal statement that clicks you? Like, okay, this is the candidate I want to interview, and then you interview them or you invite them for interview. So what is or what are some of the things that you see on CV as and the candidates stand out with those things on their CV?
Sure, that's a great question. And that's a question that a lot of applicants ask me. I meet a lot of future neurologists at various sessions and at conferences and who email me. And a lot of them want to know, what are we looking for, right? So when I'm reviewing an application, it's really what we call a holistic review process. So we really want to know kind of a broad picture of your interests. That includes both your subjective information, you describing your interests, your hobbies, your meaningful experiences, as well as the more objective information like your step scores, your transcript, your MSPE, which is sort of a combination of both, and really looking sort of as a whole at a few different things. And I think I mentioned this a lot, but if you ask any program director, they're probably going to answer this question slightly differently, just because we're all different people. We all have different experiences. We all have different pathways. We've all been, running different types of programs. And it may be that some trainees may be a better fit for our program versus another program, depending on what their goals and interests are, what their long-term career goals are. So when I'm reviewing an application, I think I really like to kind of scan the whole thing. I review the CV mainly by the key meaningful experiences, as opposed to sort of focusing on every line item. I think it really gives you an opportunity to really expound a little bit upon some of the experiences that are really playing an important role in your decision-making, whether if it was your decision-making to become a physician, decision-making to become a neurologist, or some experiences that either through research or clinical or volunteering service are really contributing to, sort of your genuine interest in my program, and also telling me about things that you are going to bring with you, so when I'm thinking about recruiting a class of residents, I really want to have a diverse array of interests and training pathways. And there's not a set activity that I'm really looking for. I'm really looking to have a wide variety when I recruit a class. So there may be some of my residents that really their application strength may be sort of their contribution to scholarly activity, whether it be within neurology or neuroscience or something else that has given them some skills that are important to bring in terms of thinking about future research questions and research projects. There may be some activities that, you've been involved in leadership. For example, an activity you may have started a group or an organization. You may have been very involved in a service organization and really discussing sort of the impact that your role has played in that organization or that community service. So those are the kinds of things that, when I'm looking at the CV part, it's important for me to sort of get to know who you are, what's important to you. Same thing with the personal statement. That's really an opportunity for you as an applicant to kind of expound on one particular, experience that maybe you want to describe in more detail than you would in the meaningful experience section. A lot of times people will talk about, an experience with a personal experience but that's by no means a requirement. Sometimes that, you don't have to, share too much about your personal life unless there's something you really want to talk about in relation to your career. Sometimes people discuss an interesting patient case they may have seen. Sometimes, it might be something totally separate. But the idea is that by reading that essay or reading that personal statement, it both gives me an idea of who you are, what's important to you, and also as a jumping off point, if I do select you, if our program does select someone for an interview, the meaningful experiences and the personal statement are really important in terms of conversation starters for your interview. So it's important that you're thinking about that part of it when you're filling out your application, because, when an interviewer is looking at your application to think about, okay, what am I going to talk to this person about? They're going to see, oh, this person was really interested in this type of community service, so am I. And, it's important that these are things that you're really well prepared to talk about, are really excited about, and really truly are sort of genuine things that you would want to discuss in an interview.
That was a really detailed and a great and wonderful answer. Thank you so much, Dr. Schuyler, for sharing all of these tips with us. So my next question would be that if you notice on a flip side, we talked about what are some of the important points. So on a flip side, if you noticed anything which may sound like a deal breaker to you, or which may look like very off thing to you, what would that thing be that candidates might be mentioning unknowingly or mistakenly on their CVs or personal statements, but they should not be mentioning them, because by seeing those things, you might not want to interview such candidates. So what would these things be in your opinion?
So I think one of the things that is sort of, just to give you inside information about how we screen, one of the things that's really easy for us to notice is if it doesn't look like a neurology application. So I know that there are, because it is really hard to match in the US. And so I think there are a number of applicants who decide to apply to more than one specialty. And so when I'm reviewing applications, it's very quick and easy for me to see if an application really looks more like an internal medicine application than a neurology application. I think that one probably stands out the most. But you really want to first and foremost be displaying your genuine interest in neurology, and that can be reflected in multiple parts of the application, not just the personal statement. So sometimes if I see an application and other than the first sentence of the personal statement saying I've always wanted to be a neurologist, the rest of it looks like an internal medicine application, then it's kind of clear that it is most likely that this person is probably applying to multiple specialties. And that's something that, we're really looking for somebody who really is excited about being a neurologist. And so I think that's something that, can be something that could, result in somebody's application being screened out potentially. In terms of the, quote unquote red flags, I think program directors and residency selection committees who are reviewing applications get pretty good at kind of, noticing if there is sort of a red flag in terms of an academic deficiency or, some other, lapse in, either within the transcript of the grades or, in the exams and things like that. And so rather than hoping that a program doesn't notice, I think it's always better to be upfront about it because we probably will notice. We're used to reviewing transcripts. We're used to reviewing, like eyeballing a USMLE transcript. And so I think it's important to be upfront. And it shouldn't necessarily be a deal breaker. I think everybody who's applying, especially, clearly you're at a prestigious medical school and it's taken a lot to get to that point. And your performance in medical school shouldn't be judged by a single day. So if you had a bad day, there was like one course you had trouble with, or you had a semester or a term that, there was something going on in your personal life and your performance wasn't up to your usual standard. I don't think that for most people that would really be a deal breaker, but I think it's important to explain and kind of expound upon sort of your reflection on that. So for example, with a test failure or needing to repeat a step or something like that, really, being able to explain sort of the insight you have into why your performance wasn't up to par, and maybe what was your strategy, what was your way of remedying that, and actually being able to demonstrate either, if you took the next step and you got a really high score there, or if you repeated that, that shelf exam and got an honors, to really that can demonstrate, that can actually be a positive. It demonstrates resilience, and it gives you an opportunity to explain how you're able to, turn around an unfortunate situation and now really excel afterwards. So I think that's, not just my take, but a lot of program directors really, take that view on sort of red flags in applications.
Absolutely. This was an amazing answer. Thank you so much, Dr. Schuyler. And as you said that there could be a bad day, so I would continue that discussion. And we have received this question a lot from students that some students say that they are not perfect in all aspects, considering research, volunteership, and scores. So how do you personally balance all of this if a person does not have a very high score, but they do have a good CV, like they have research, they have volunteership on their CV, leadership, but they do not have a good score, let's say, or if they do not have a good lot of research, but they do have good scores or leadership or volunteership. So how do you personally balance these aspects of CV?
Yeah, I mean, I think that's the whole idea of the holistic review, is really kind of looking at all of those. And it's not a specific numerical score system that I use for the different sections. I think some programs have gotten a little bit more detailed with numerical scoring. When I've tried to do that personally, it usually ends up me imposing my score on what I think of it after the fact. So I've never been able to get like my scoring system to exactly match exactly what I want. And so it might be that someone who's more, able to, understand the nuances of that, or to, I don't know if people are using AI or using more, more specific algorithms or things like that to score applications. For me, I just read through them quickly. But really the idea of holistic review is that, that's an assumption that nobody's going to be, the most outstanding person in all possible facets of their application. And therefore, reading it as a whole, I can get a sense of sort of what their interests are, and kind of, because I'm picturing what is this applicant going to be like as a resident? Are they going to succeed? Are they going to excel? And are they going to really add in a positive way to our culture and environment, and our training environment and our teaching environment? So those are really the things that that's what I'm thinking about as I review the applications. It's really not, how can I weed out somebody because their score is 1 point lower? It's really thinking about, who is this person as a whole, and how would they, how would they do in my program, in terms of kind of knowing our culture and our values and our diversity and all, and our emphasis on medical education and teaching.
Right, that makes a lot of sense. Thank you so much for that. So we have received one more question a lot of times, which is about research. So as med students, we do not get chance to particularly do our research in neurology, but we do have a chance to do research in internal medicine, cardio, pulmo, and a lot of other things, because as med students, we are getting very small amount of opportunity. So students are confused, applicants are confused, because for neurology, we have heard that we need a very neurology centered and neurology oriented CV. That's what most programs are looking for. So do you appreciate if someone mentions other researches other than neurology, or do you think that this thing is also a red flag and they are interested in something else and they have done multiple research papers in other specialities but not in neurology? So could you please
Sure. Yeah, so I think it's important, to both demonstrate your interest in neurology, like I said, in multiple ways on the application, but you don't have to leave out significant research experiences that weren't in neuroscience or neurology. That's a significant, that may be a significant, contributor to your desire to pursue scholarly activity potentially within neurology in the future. And it also gives you skills, like just in general, having some basic skills in like research methodology or statistics and things like that are really important to have if you're thinking about potentially doing some scholarly activity within neurology or in residency or after that, down the road. So I wouldn't leave that off. And I think it is definitely possible to incorporate experiences that are outside of neurology within your application. Also, if you think about it, our US applicants are spending, they're applying in their 4th year of medical school. And at most, they've probably spent during medical school maybe 2, at most 3 months doing neurology. And usually, unless they've done a research year or something separate from medical school, they're not going to have extensive research experience either. Our non-US international applicants oftentimes, have attended medical school for a longer duration of time just by nature of how the education system is set up. And also most times have done some sort of compulsory or rotating internship after they've graduated from the medical coursework, which is in addition to what US medical students have done. So they're coming in with an additional clinical year of training prior to doing their PGY 1 year. And oftentimes are spending 1 to 4 years in the US many times doing research or doing other activities. So it's a very different group of, kind of activities in many cases when we're looking at current US med students versus our non-US IMG applicants.
That makes a lot of sense. Yeah, we do have one more question. You already explained it very well in your first answer. But what are some of the things that applicants can do to make their personal statement strong or to stand out by their personal statement? Because we have heard a lot that personal statement makes a lot of impact when program directors are reviewing it and all. And so what are some of the things? There are 2 opinions about it. One is to mention your hobbies and interest and what kind of a person you are without mentioning your stuff that was already on your CV, like your achievements and your grades and your experiences. And some say that no, you should mention about neurology and only neurology. So there are 2 opinions in med school. So what do you suggest? What do you personally value while reading the personal statement?
Sure. Well, I think either of those approaches can be effective. And I think it really depends on kind of where your passions lie and sort of what is important to you, because rather than trying to follow a formula, I think you're probably going to do the best if you pick a topic that you are passionate about, whether that is something related to patient care, if it's something related to an activity or meaningful experience that you really want to talk about to that degree, or if it's something totally outside of medicine. And, it is a little bit of a gamble, I think, to write an essay on something that's completely outside of medicine, but sometimes it works really well. So, it really, I have to say it depends, and not to be just kind of wishy-washy about it, but it really does depend. And I think the majority of essays probably don't make or break whether or not someone's getting an interview. I think a lot of, the majority of essays probably fall into sort of a neutral category. There are probably a handful that for either it ends up very poorly written or something's written about that's just not, that ends up sort of being a negative in the application. And then there's usually a handful on the other side, but it's not the majority of them, but occasionally there'll be an essay that is, oftentimes, so well written, it'll be just like that a piece of writing that's just really impressive. And oftentimes I'll look back and be like, okay, that makes sense. This person studied, English literature or, writing, in school. And so that's, that explains why, they're able to write, a certain caliber of essay that's not the norm. And sometimes somebody will just write about some type of experience that for some reason, really resonates with me and like makes me want to meet that person and talk to them more. But by and large, really the majority of essays are pretty neutral in terms of just scanning through them. Sounds like, what they talk about, seems like, pretty routine, just from having read tens of thousands of them, like, not many of them are something I've never read about before. My other piece of advice about the essay, which I usually give, is to make sure, in addition to having it well edited, make sure that, maybe you've had somebody else read it and check it, and make sure that, the grammar and, that the writing itself doesn't have any glaring errors, would be that if you're presenting a case, like a neurology patient, in your essay, keep in mind that the people reading your essay are very experienced neurologists, they're very experienced clinicians. So if you're discussing localization or discussing a differential diagnosis or discussing an unusual case, you need to be prepared to talk about that, because oftentimes, and this happens a lot of times, especially if you have very senior faculty or chair types that are interviewing, they tend to like pick up that case and maybe ask you some more detailed questions about, well, why did you think it was this diagnosis? And, so you really need to be well-versed in both the neuroanatomy and localization and differential diagnosis, and able to have sort of a conversation about that patient potentially. So you want to make sure you've got everything right if you're going to put a case in an essay, and be really ready to talk about that case, elaborate more.
That was a really great point. Honestly, a lot of applicants I have seen, do mention about any case they have observed or any memorable case they have seen during their internship. So that was a really great point. So let's talk a little bit about the interview session. While you are interviewing the candidates, what are some of the points that you would like to advise them that they should follow, and what are some of the things that they should not be doing during their interview session? So what would be that?
Sure. So the interview is really meant, and we're doing this in the virtual environment. So I think one of the things that's really important, and at this point, most people are comfortable doing that. I know early on in the first couple of years that we were doing virtual interviews, when people weren't as familiar with, doing all these like Teams and Zoom and whatever meetings, it was a little bit awkward. But I think one of the main things is to make sure that you're comfortable in the virtual environment to have a conversation and to practice. So I think really making sure to practice a few times with somebody you're comfortable, kind of going through some of the more commonly asked questions and having your answers kind of, not scripted, but just you're able to talk comfortably about those, your career goals or your interests, and, have a few things prepared in terms of your activities that you want to elaborate on, make sure you're ready for those. And I think practicing a few times like in this environment is very helpful. I think one of the things I would advise against is kind of that scripted part of it. So, sometimes, and I know it can be really nerve-wracking, people get nervous, but sometimes if somebody has a tendency to kind of maybe have something written in front of them or off to the side of them and then kind of go through that, it makes it harder for the interview to be a conversation. And I think it's good to have, good to be ready to talk about your background and some highlights about yourself, but it doesn't make sense to kind of go through if we have a 10 to 15 minute window to meet, I think the interviewers are going to want to use that time to ask questions as opposed to, kind of hear more of a prepared script or speech about, something that you want to make sure to talk about, and try to kind of work that more into the back and forth conversation. I think that that's important. One of the things that interviewers are really looking for is kind of your communication skills. So part of that, and it's hard because, you are in a virtual environment, but kind of, kind of taking a conversation, leading it in a certain way, and then based on their answers, kind of taking it another step. And I think many of us who interview a lot are pretty good at that. So, really sort of practicing and being open to that style of conversation, I think, is something that's not like instantly natural. So it's good to kind of to work at it a little bit in the weeks before you start your interviews.
All right, that makes a lot of sense. I think we just have a few more questions. Okay, so I would like to know about your program, UConn, that what are some of the unique features, and a little bit about the academic training and the clinical side and the fellowship options that usually the residents get from the UConn. If you can please share about that.
Sure. So Our program is really at 2 main sites. So we have a categorical program. We have 7 residents per year, so a total of 28 residents. They are from a variety of different training pathways. If you kind of look on our website, you'll see that it really is a mix of US, MD, DO, US IMGs and non-US IMGs in our program. Same thing with our faculty. We have a very diverse faculty from a lot of training pathways who are also many of our faculty are internationally trained as well. And then we have sort of a local group. We do have quite a few of our faculty as well as our students who are local from Connecticut who want to stay close to home. So, it's a great mix. And I think that's one of the, key things about our program is really sort of the culture and the vibe. It's a very friendly program. Our residents are awesome. Our faculty are awesome. It's a great place to live. Central Connecticut's really nice. I love it here. In terms of our program specifics, our primary rotation site is in downtown Hartford. Hartford Hospital has over 900 beds, I think, at this point. They're planning on building a tower that will bring the census up to 1,200. So it's a very large hospital, but it's in a very small city. So you're actually, it's kind of the best of both worlds because it's a huge training hospital, the breadth and depth of patients, the complexity. It's a very acute care hospital, a lot of ICU patients. And so, but it's in an area where you can drive a few miles and there's countryside and hiking trails and stuff, but it's a huge hospital. So really I just think it's a great place to train. Every time I'm working with residents, I'm always blown away by all of these, crazy cases we see. They also get a ton of exposure to stroke care within the treatment window. We have incredibly high number of stroke treatment cases. We're doing a ton of thrombolytic and interventional thrombectomy kinds of treatments. Our residents are first line and doing all that. They get a ton of experience with acute stroke care. We have 2 neuro ICUs, so there's a lot of high acuity patients requiring long-term EEG. And then we have a level 4 epilepsy surgery center. So there's a lot going on in terms of our epilepsy monitoring unit, doing ICU monitoring, doing lots of different types of surgery to treat epilepsy. And that's all on the inpatient side. Our second rotation site is UConn Health, which is about a 10-minute drive. So some people are like, we do have 2 sites. The continuity clinic is located at UConn Health. That health center is more in the suburbs. So it's more sort of in the, I won't say countryside, but it's definitely a bit, more rural. It's outside the city and it's a much smaller hospital. So at that hospital, it's only about 200 beds. So we're consult only, which really gives our residents the experience to see what it's like as sort of a consultant neurologist for a hospital. Even though it is an academic teaching hospital, the way that neurology is practiced, where you're co-managing patients with neurological disorders with internal medicine, as opposed to primary admitting, is a different style. And that's a style of practice that takes place at pretty much most hospitals that aren't large academic centers. So I think it's a good, it's a good variety in that way. And then in terms of outpatient subspecialties, one of the features of our program, we do continuity clinic for all 4 years. So our PGY1s during their medicine year do have a weekly continuity clinic with neurology, gives them an extra year to see neurology patients, has connection with our department and the residents and the faculty in the clinic. And then our breadth of subspecialties is also excellent. I mean, we have neuro-ophthalmologists and MS specialists, if you name it, sports neurology, a big movement disorder center, a huge headache center, so across the outpatient-based subspecialties, there's really a lot of opportunity to be exposed to and try all the different outpatient-based subspecialties. And we try to get it up as, upfront in residency as possible so that you have time to try everything before it's time to really think about subspecialty fellowship options.
All right. Thank you so much, Dr. Schuyler, for walking us through all of these things.
Yeah.
And obviously, a very advanced training is going on at UConn, and we are really interested in applying at UConn this year. Okay. So yeah, my last question would be, what would be your advice for someone who didn't match last year and are reapplying for this match cycle? What are some of the things that they can avoid doing, or some of the things that they should do this match cycle, especially for those applicants who didn't match last year?
Yeah, I mean, it's tricky because it's hard to know. There's a lot of reasons why someone may not have matched. Part of it may be luck of the draw, honestly, because, I'm sure there are plenty of strong applicants that are not matching just by nature of the numbers, but I think it really depends on kind of, kind of reflection on what aspects of the application may need to be strengthened more in order to be successful. Oftentimes, so if you are reapplying, I think it's probably important to make sure that there are some continued activities going on that are continuing to strengthen the application. And just, having some updates there or continued research, or if there's a way to obtain additional clinical experience or US clinical experience that maybe, could result in having another US clinical letter that's really strong. I mean, so those are some of the ways that might help. And also, just maybe having some mentors or maybe some, past alumni from your school that have been successful in matching to kind of maybe get some mentorship there. I think that's a really important resource, is to talk to both current residents and faculty who have done training at maybe some of the programs you're interested in, to get some more information from them can be really helpful in kind of strengthening your application for the next year.
All right, that makes a lot of sense. And lastly, if you have any advice in general for all the Neurology 2026 match applicants that you would like to say, and especially for the sign group DMC, if you have any advice for us.
Sure. I mean, I think I would just say to try to enjoy the process. I know it can be stressful and anxiety provoking to think about. First off, applying to a program where you'll be training for 4+ years, potentially, 6 years if you're going to do a 2-year fellowship afterwards. That's a huge leap. And so, I understand, how stressful that could be. But I think that, if you can try to really, make an application that you're proud of, that's really demonstrating, your achievements, your accomplishments, your goals. I mean, and really be excited about, talking about those things, like, when you get interviews. I think that's really going to result in success. And I think the more you can try to just enjoy, the opportunity to meet lots of different trainees. So when you're doing your interviews, you're going to be meeting current trainees, you're going to be meeting lots of faculty, you're going to be meeting program directors and chairs. These are people that you may, even if you don't match at that program, that you may be seeing as colleagues in the future, depending on, you're only going to match at one program, but if you're interviewing at multiple places, it's really a great opportunity to sort of network and really, establish connections with future colleagues. So I would say to try to, make the most of that aspect as well, while you're trying to sort of make the decision about where you would be a good fit. Keep in mind that the programs are also trying to do the same thing, we're trying to attract the best candidates that we can. We're trying to recruit applicants that we feel will be really successful as future residents and potentially as future faculty colleagues. In our program, so many of our faculty, I've been there for 16 years. A lot of our faculty, both at UConn and at Hartford Healthcare, are former grads from our program. So when we're selecting residents, that has the potential of being somebody that is going to be, a career-long colleague. So I think we're really trying to feel you out the same way you're trying to kind of see if you'd be a good fit for, and really are these people you'd want to work with? Is this a place you want to live? Do I have friends and family here in this area? All those factors that go into your decision as well.
All right. Thank you so much, Dr. Schuyler, for taking out time to do this session with us. This will be really useful for all of our audience. So we will be ending this episode 3 podcast here, Road to Residency, and we will see you all again in episode 4. Thank you so much again, Dr. Schuyler, for sharing all of these amazing insights about your program and in general the match application process with us. And we will see you again in episode 4. Goodbye, everyone. Take care.